Hello everyone, welcome to the certificate course on reproductive health education. In today's class, we will be discussing on family planning and contraception. Overview of family planning. This section provides a fundamental understanding of family planning, which involves the conscious decision making process regarding the timing and spacing of pregnancies. It emphasizes the importance of family planning in promoting reproductive health, empowering individuals and couples to make informed choices about their fertility. Barrier methods of contraception. Barrier methods create a physical barrier between sperm and the egg, preventing fertilization. This includes condoms, male condoms and female condoms. Condoms are sheaths worn over the penis, that is called male condom, or inserted into the vagina or the female condoms to block sperm from entering the reproductive tract. They also provide protection against sexually transmitted infections. On screen, you can able to see how male can be use these male condoms. There are it has been shown in 5 steps. Use a new condom for each sex act. Before any contact, place condom on tip of erect penis with rolled side out. Unroll condom all the way to base of penis. After ejaculation, hold rim of condom in place and withdraw penis while it is still hot. Use only once. Throw away used condom safely. Use of female condoms. Female condoms Female condoms can be inserted into the vagina. Diaphragms and cervical caps also considered as barrier method of contraception. These are flexible silicone or latex devices inserted into the vagina to cover the cervix, preventing sperm from reaching the uterus. They are used with spermicide and require proper fitting for effectiveness. Next is the hormonal methods of contraception. Hormonal methods of contraception. Hormonal contraceptives contain synthetic hormones, either it is estrogen and progestin, that mimic the hormonal changes of pregnancy, thereby preventing ovulation and altering the cervical mucus to inhibit sperm penetration. They include oral contraceptives, also known as birth control pills. They are taken daily to prevent pregnancy. They are available in combination pills containing estrogen and progestin, or progestin only in pills. Injectable contraceptives. Injectable forms of progestin administered every few months to prevent ovulation and to prevent thickenal cervical mucus. Patches and vaginal rings. These methods deliver hormones through the skin or vaginal insertion, providing continuous contraception for weeks at a time. Ring and patch. The transdermal contraceptive patch contains synthetic estrogen and progestin and remains effective for an entire week. The patient should start the patch on the first day of her menstrual period and replace it weekly for 3 weeks. The fourth week is patch free to allow a withdrawal bleed. Placement on clean dry skin located on the buttocks, upper outer arm, or lower abdomen is recommended. Because of its ease of application and improved compliance, the method failure and the person failure of the patch are almost identical. Caution should be used when prescribing the patch for women weighing more than 90 kg because if it is decreased efficacy, side effects and contraindications are similar to these. OCs. A complaint specific to the patch, however, includes skin irritation from adhesive residue at the application site. The contraceptive vaginal ring releases a sustained amount of synthetic estrogen and progestin daily. Comparable with oral contraceptives in efficacy, the ring is associated with greater compliance because of its once a month usage. Contraceptives, intrauterine devices. Now, these comes under long-acting reversible contraceptives. Long-acting reversible contraceptives are highly effective reversible contraceptive methods that require minimal user intervention. They include intrauterine devices. Intrauterine devices or IUDs, small T-shaped devices inserted into the uterus to prevent pregnancy. They can be hormonal or non-hormonal and provide protection for several years. And even under long-acting reversible contraceptives, we have implants. Now, these implants are tiny rods inserted under the skin of the upper arm, releasing progestin to prevent ovulation and thicken cervical mucus. They offer long term contraception for several years. So, here, while explaining about contraceptive vaginal ring, uh, I forgot to mention about how it is placed. It placed into the vagina by the person at the beginning of her menses. If it's left in place for 3 weeks, removal of the devices result in a withdrawal bleed. The ring can be taken out of the vagina for up to 3 hours if desired without altering its efficacy. Because it is colorless and odorless, with a 2-inch diameter, most of the women and their partners are unaware of the presence of the ring. An advantage of the ring over on oral contraceptive is decreased incidence of breakthrough bleedings. Because the hormones in the vaginal ring and the transdermal patches do not get absorbed through the gastrointestinal tract, some of the medication interactions that occur with the combined oral contraceptives may not apply. However, metabolism still occurs in the liver and therefore caution must be used. So, next is about what is it called? Emergency contraception. Emergency contraception. Emergency contraception methods are used after unprotected intercourse or contraceptive failure to prevent pregnancy. They include contraceptive pills, commonly we can call it as ECPS, also known as the morning after pill. ECPs containing hormones, progestin, or a combination of hormones to prevent ovulation or fertilization if taken within a specific time frame after intercourse. Intrauterine device. Copper intrauterine devices CUIUD. This non-hormonal IUD can be used as emergency contraception if inserted within a few days after unprotected intercourse. It prevents sperm from the fertilizing the egg and may also prevent implantation. Natural methods of family planning. Natural family planning methods rely on tracking menstrual cycles and fertility signs to determine fertile and infertile periods. They include calendar method. Calendar method, here it is a predicting fertile days based on the length of menstrual cycles. Basal body temperature method. The basal temperature method is based on detecting the increase in basal temperature that a woman experiences in each menstrual cycle once ovulation has occurred, that is, the release of the egg from the ovary. The reason for this increase in the woman's basal temperature is the increase in the level of the hormone progesterone, which is produced by the corpus luteum, formed by the remain of the empty ovarian follicle after ovulation. The increase in basal temperature is about zero point 0.3 to zero point 0.5 degrees Celsius, and if a pattern can be established by menstruing basal temperature over several menstrual cycles, it will be possible to estimate when woman ovulates. Cervical mucus method. Now here, by observing cervical mucus method, even we can plan for family. Observing changes in cervical mucus, that is mucus consistency, to identify fertile days. So in the figure, you can able to see the follicular phase, ovulation, and luteal phase. And in ovulation, we can able to see the mucus consistency. Okay, mucus consistency. Whereas in follicular phase as well as luteal phase, there is no proper mucus consistency. There is no in between. In between the finger, we cannot able to see the mucus. Whereas in ovulation, it is very thick and it is attached to the two fingers. So based on that, we can able to identify the day of ovulation. This last part is counseling on choosing appropriate contraceptive methods. Counseling aims to help individuals and couples make formed decisions about contraception based on their preferences, lifestyle, medical history, and contraceptive needs. It involves discussing the efficacy, side effect, benefits, and considerations of each contraceptive method to tailor the choice to the individual circumstances. With this, I finished the topic on family planning and contraception. With the next topic, we can meet again. See you later.